So if a patient goes to your practice, and it's one of the two categories of dental implant patients, you've got the one patient that's wearing a denture, and the other patient that it's been determined all of their teeth have to be removed. They both want upper and lower teeth that don't come out supported by implants. What's the process in your office?
Yeah, Randy, so the process in our office is basically a 3-step process.
Okay.
The first step is just us meeting, and that's where we kind of determine, where you want to be at the end of this process. It's really important to me to kind of get to know you a little bit.
Okay.
Because my main goal in doing this for you is to help you be a better version of yourself. And that's where we kind of get to know each other and decide what you want your smile to be like. We usually give people, a couple options, 2 or 3 options.
Okay.
And we'll also go over finances during that appointment. So you have a clear understanding of what it's going to cost to do what you want to do.
Okay, so once they say, yes, I want to move forward with it, now what?
So the good news is it's really just two steps after that. Your next step is going to be your smile design, and that's where we get to pick out what you want to look like at the end of this process.
Okay.
It's really fun for us because this is where we kind of get to design your new personality. And my team and I really take a lot of pleasure in helping people, figure out what the new version of you is going to be like. So the next step is the appointment where you get your new teeth. And during that appointment, you're going to be sedated for that appointment. And when you wake up, you're going to have a brand new smile. You're going to go through this recovery phase. It's 2 or 3 days. And then you're kind of off and running with your new teeth.
So how soon could they eat?
I recommend starting for 2 or 3 days just with soft foods. And then after that, as you get more comfortable, you'll be off and eating, sort of normal foods again.
Now, can they eat chewy things like steaks or like beef? I mean, when they're all healed up.
Yeah, so after this process is done and you're all healed up, yes, you will be able to eat anything you want to eat.
And do they? Are they eating things they shouldn't eat sometimes?
Yeah, that's the funny part for me is to when people come back for their follow-up visits to hear what they've been eating. And I hear all kinds of things. And I'm like, well, maybe not the beef jerky just yet. But yeah, you should be eating really better than you ate before your procedure. With your new teeth.
Now, correct me if I'm wrong. The way dental implants are typically done is in 2 different offices. One office that does the surgery for the implants,
right,
and another office that puts the teeth on top. At your office, you do both parts. Is that correct?
Yeah, we do it differently than most people. I've designed our office to be able to complete this process start to finish for people.
Okay.
I'm really passionate about being the person that takes you through this whole process. When we first got into this process for people, it was very segmented, and it was hard for people because they had to go to one doctor for this, one doctor for that, and I realized there was a better way.
Okay.
And so in our office, you will be having your procedure to where you have your teeth removed and the dental implants, and I will also be restoring those dental implants with your new smile. So I think that's a better process because it's more streamlined. There's not this gap in communication between offices and things like that. And it really makes it more affordable for people too.